The Laser Institute at Empire Eye Physicians has been designed to provide patients with state-of-the-art refractive laser surgery in a professional, yet comfortable and low-stress surgical environment. Our elite team of eye physicians and staff are here to care for you in a very personalized, ethical, and caring manner.
Hi, I'm Dr. Mark Contos, surgeon here at Empire Eye Physicians. This video has been created to enhance your understanding of the two primary laser refractive eye surgeries, PRK and LASIK. We will discuss the potential risks and complications of these surgeries, as well as the possible alternative treatments that may be available. Our goal is for you to have all the information that you need in order to make an educated decision as to whether laser refractive eye surgery is the right choice for you.
As light enters the eye, it passes through the cornea on the surface of the eye and the lens in the middle of the eye. The light waves are bent so that they can focus sharply on the retina in the back of the eye. There are three basic refractive errors that occur when the eye cannot properly focus light onto the retina. Nearsightedness. Nearsightedness, or myopia, is the condition where objects in the distance are blurred, but close objects are seen more clearly. This occurs because the cornea and lens powers are too strong for the length of the eye. The light waves are bent too sharply and create a focused image in front of the retina rather than on the retina. Farsightedness. Farsightedness, or hyperopia, is the condition where objects up close are very blurred, and objects in the distance are seen more clearly, but may also be blurred. This is because either the cornea and lens has too little focusing power, or the eyeball is too short, and light rays hit the retina before they have been properly focused. Astigmatism. Astigmatism is the condition that causes blurred vision in all distances, and this is due to an irregular shape of either the cornea or the lens inside the eye. All three of these refractive disorders can be corrected with refractive laser surgery, such as LASIK or PRK. LASIK, or laser-assisted in situ keratomy lucis, is a surgical procedure utilizing two separate lasers to change the shape of the cornea, which allows light rays to be focused clearly on the surface of the retina. LASIK is the most common surgical procedure performed, and several million patients in the United States have undergone LASIK since its beginning in 1996. In modern LASIK, a femtosecond laser is used to create a thin corneal flap near the surface of the cornea. Older surgical versions of LASIK created a flap using a blade, but with advances in technology, the laser creates a safer, more precise flap. This flap is laid back, allowing access to the middle layers of the cornea. A second laser, the excimer laser, is used to precisely remove a fine amount of corneal tissue to reshape the cornea and allow the new corneal curvature to correct vision. The flap is then folded back into place to seal the cornea and begins to heal on contact. One of the primary advantages to LASIK is its rapid healing, with most patients having improved vision within a very short time after surgery. It is, however, a more complex procedure because of the creation of the corneal flap. Photorefractive keratectomy, or PRK, is a procedure similar to, and actually a precursor to LASIK. PRK surgery involves most of the same processes as LASIK, with one major exception. Unlike LASIK, where the flap is created, in PRK, the physician gently removes the corneal epithelium, or protective surface layer of the cornea. Then, the same excimer laser used in LASIK precisely removes a fine amount of corneal tissue to reshape the cornea and allow the new corneal curvature to correct vision. A contact lens is then placed on the eye for several days until the cornea has healed. The epithelium grows back within 3 to 4 days, and the vision gradually improves over the next several days. For some patients whose cornea may be too thin or irregular for LASIK, PRK may be a better choice. There are certain occupations that require PRK as opposed to LASIK, such as certain military or police requirements. Once the eye has healed, the visual results of PRK and LASIK are identical. For patients who are not candidates for LASIK or PRK, an alternative procedure, the implantable contact lens, or ICL, is a possibility. This procedure is different in that it does not alter the structure of the eye and does not involve corneal tissue removal. For this surgery, a very thin implantable contact lens is inserted into the eye through a small opening, and placed directly behind the iris and in front of the eye's crystalline lens. The ICL works naturally with your eye's optical system to enhance vision. One of the advantages of ICL is that it is a reversible procedure in that the lens can be removed if necessary or can be changed for a different lens. ICL surgery is a more involved procedure than LASIK or PRK and is performed in the operating suite, one eye at a time. LASIK and PRK are performed at the Laser Institute as an outpatient surgery, which is done under topical anesthesia. It only takes a few seconds for the laser treatment itself, and most people consider the procedures to be pain-free. Prior to beginning the procedure, you will receive a mild sedative that will allow you to be comfortable during the entire process. The eye will be anesthetized using eye drops, and a device will be placed around the eyelids to prevent you from worrying about blinking. The surgery itself requires very little in terms of patient participation. The entire process from the time you arrive at the laser center until the time you are ready to leave is generally less than 1 hour. We recommend that after your procedure, you take the remainder of the day to go home and rest, and a nap is generally a good idea soon after surgery. You will be seen the following day in the office to evaluate your vision and check that the eye is healing appropriately. Most people are able to resume normal activities, although it is important that you are careful around your eye, and there may be some activities that will need to be postponed for the first week or so. When considering elective refractive surgery, such as LASIK or PRK, it is important to have a good understanding of what the potential benefits of the surgery are, as well as the potential risks and limitations. The goal of LASIK and PRK is to reduce or eliminate your dependence on corrective lenses. For most patients, refractive surgery achieves this goal. However, not everyone will be able to have complete independence from glasses or perfect 20/20 vision after surgery. In addition, most patients as they age will need to wear reading glasses. As the eye ages, it develops presbyopia, which is independent of the conditions that LASIK and PRK are treating. Therefore, the need for reading glasses over the age of 40 is inevitable for most patients. For the vast majority of patients, a single surgery will provide the desired result. However, for some, it is possible that the eye may heal in such a way that a small amount of nearsightedness, farsightedness, or astigmatism returns to the eye after surgery. If this occurs, it is possible that a secondary procedure or enhancement may be performed once the eye has healed and is stable. After surgery, some patients experience certain side effects. Some of these include increased dryness in the eyes after surgery and glare or halos at night. These conditions are common immediately after surgery and generally resolve as the eye heals over the next several weeks. However, for a very small percentage of individuals, dry eyes, halos, or glare at night may persist and may be permanent after the surgery. In a very small percentage of patients, additional risks or possible complications are best corrected vision less than 20/20, infection, allergic reaction, inflammation, irregular cornea healing, weakening, or scarring. Complications are an inherent part of surgery, and despite our best efforts, some patients will experience problems after surgery. Unfortunately, there is no way to guarantee a perfect result. It is important for all patients to have a good understanding of what the potential risks of refractive surgery are to be able to make an informed decision. No one ever believes that they will be in the small percentage of people that will develop a significant complication, but it is important to have a good understanding of these possibilities. Fortunately, for most people who experience problems after refractive laser surgery, a satisfactory resolution of the problem can be attained, although as mentioned, this may require additional procedures or prolonged healing time. To greatly minimize the risk of complications, it is very important that all patients follow the post-operative instructions regarding medications and proper care of the eye. In addition, it is essential that patients complete their follow-up visits and routine eye exams with a regular eye doctor.
For many, the decision to have laser vision corrective surgery is one of the most important health decisions that they can make. We greatly value the trust that you place in Empire Eye physicians to provide you with the best possible surgical experience. We will do everything in our power to make sure that your decision to go forward with laser eye surgery is the positive, life-changing event that many people before you have experienced.
Every once in a while I have that reality check of, these are my eyes now, there's nothing helping my eyes see that.
Freedom that LASIK has given me has been life-changing.
There wasn't this distraction, you know what I mean, of having this thing on my face.
The procedure itself was very simple and a lot easier than I expected it to be.
It was so easy and so simple that if I had to do it again, it would be not a very big deal.
I get to open my eyes and see in the morning.
I can just actually get up and go, and I don't have to worry about the glasses.
Don't waste any more time. Just go get it done, because it's not much more time you get to live without contacts.